Hi everyone, in this session let's see the development of respiratory system. As we all know, the GIT is made up of three portions: the foregut, midgut and hindgut. And the respiratory diverticulum, known as the laryngotracheal diverticulum, it's seen as a bud developing from the ventral portion of foregut. So this portion is known as the foregut, and from the ventral portion of foregut we can see one diverticulum known as laryngotracheal diverticulum developing by almost the end of 4th week of intrauterine life. So first it develops as a diverticulum, and we can see that the opening between the laryngotracheal diverticulum and the foregut is common, so that there is no separation between the laryngotracheal diverticulum and the foregut. So there should be some separation so that two entirely different tubes are formed. One is the esophagus and the other one is trachea. For that we need a septum separating the laryngotracheal diverticulum from the foregut. So first there are two folds developing at the junction of the diverticulum and the foregut. They are known as tracheoesophageal folds. Later on what happens is these tracheoesophageal folds meet towards the midline and they fuse in the entire length of the diverticulum to form the tracheoesophageal septum. And after the formation of tracheoesophageal septum, these two tubes get separated. So ventrally you have the laryngotracheal tube and dorsally you have the future oropharynx and esophagus. So that is what is happening in the initial phases of respiratory development. So first you have the laryngotracheal diverticulum developing from the cranial end of the foregut. First there will be a direct communication between the two tubes. By the formation of tracheoesophageal folds, there will be a formation of septum known as tracheoesophageal septum along the length of the diverticulum, which separates these two tubes. One will be seen in the ventral aspect and the other one will be in the dorsal aspect. In the ventral aspect we call it as laryngotracheal tube, and in the dorsal aspect we know that it is actually the foregut is forming the oropharynx and the esophagus. Now let's see what are the derivatives of laryngotracheal tube. So generally speaking, we can say that the mucous membrane and the lining epithelium, including the alveoli, are formed from the endoderm because it is actually a derivative of foregut. So the lining epithelium, the mucous membrane, will be developed from the endoderm. And what about the muscle, cartilage and the fibroareolar stroma? They are developed from the surrounding sponge-nuclearic mesoderm. So that is in general about the development of respiratory tract as a total. Now let's see what are the derivatives of laryngotracheal tube. The laryngotracheal tube gives rise to four main structures. We have the larynx, we have the trachea, we have the bronchi and we have the remaining of the lung tissue. First we will see about the larynx. So what about the larynx? So larynx has got an epithelium. It is made up of cartilage and muscles and something about the nerve supply. Epithelium, as we have already mentioned, it is derived from the endoderm. What about the cartilages and muscles? So these are derived from the 4th and 6th pharyngeal arches. I will be doing the pharyngeal arches soon. Many have requested me to do pharyngeal arches, so I will be doing it soon. So the cartilage and muscles of the larynx are derived from the 4th and 6th pharyngeal arches. So it is from the 4th arch we have the development of thyroid, epiglottis and cuneiform cartilages. Thyroid, epiglottis and cuneiform cartilages are formed from the 4th pharyngeal arch, and it is from the 6th pharyngeal arch we have the remaining cartilages which make up the larynx. They are the cricoid, C stands for cricoid, A stands for arytenoid and again C stands for corniculate. So cricoid, arytenoid and corniculate cartilages are derived from the 6th pharyngeal arch, and thyroid, epiglottis and cuneiform are derived from the 4th pharyngeal arches. About the nerve supply, they are supplied by 10 cranial nerve, that is vagus, and the structures derived from the 4th pharyngeal arch are getting the nerve supply from the superior laryngeal, whereas the structures derived from the 6th pharyngeal arch are getting its nerve supply from the recurrent laryngeal nerve. Now we will see about trachea. So trachea has got epithelium and again it is made up of muscles, cartilages and the fibroareolar stroma. So the epithelium, as we have already mentioned, it is derived from the endoderm, and the fibroareolar stroma, the muscles and the cartilage all are derived from the sponge-nuclearic mesoderm. So we mentioned up to the larynx, up to the trachea, then you have the bronchus developing from the laryngotracheal tube. So we can see there are two buds. In the beginning we have two buds, they are known as the bronchial buds, and by the end of 5th week on the right side we have 3 buds developing from the right bud and 2 buds developing from the left bud. They are known as lobar bronchi. And further stages of maturation are dealt as 4 stages of maturation of lungs. 4 stages of maturation of lungs. So at this stage actually what is happening is these 2 buds are invaginating into the splanchnopleuric layer of the pleuromic coelom. So this splanchnopleuric layer is actually developing as the pulmonary pleura. These 2 lung buds will be invaginating into the coelomic cavity on either side, pleuromic coelom, and it is the splanchnopleuric layer which is closely investing these buds which are giving rise to the pulmonary pleura. Now further maturation of the lung can be dealt under 4 stages. They are the pseudoglandular stage, the second one is canalicular stage, third one is terminal sac stage, and the fourth one is alveolar stage. So these are the 4 stages under which the lung is getting matured. First one, let's see, that is known as pseudoglandular stage. This extends between 6 to 16 weeks of intrauterine life. So what is happening during the pseudoglandular stage? In the pseudoglandular stage, the proximal and distal portions of the respiratory tract are lined by tall columnar cells and cuboidal cells respectively. That is, in the proximal portion you have the lining epithelium tall columnar, and in the distal aspect we have the cuboidal epithelium. So altogether when you look at the developing lung, it will look like a tubuloacinar gland. So it is actually giving a pseudo look of a gland. Hence you call it as pseudoglandular stage. And the mesenchyme surrounding will be giving rise to the cartilage, the muscle and the fibroareolar stroma. Now the second stage is known as canalicular stage. Canalicular stage actually extends between 16 weeks to 26 weeks. So what is happening in the canalicular stage? In the canalicular stage, the terminal bronchioles, up to the terminal bronchioles, the lumen will be actually enlarged and the lung tissue becomes more vascular. Then what happens is there is differentiation of cells into type 1 pneumocytes. So the cells which are not getting differentiated will be forming type 2 pneumocytes. So there is development of type 1 as well as type 2 pneumocytes. That is what is happening in the canalicular stage. So the cells which are getting differentiated, we call it as type 1 pneumocytes, and the cells which are not getting differentiated, they are known as type 2 pneumocytes, and it is the type 2 pneumocytes which are storing surfactants. And they are also considered as stem cells because this will give rise to further, or this will add on cells into the alveolar ducts and alveolar sacs. Now the third stage. What is the third stage? This is known as terminal sac stage. Terminal sac stage extends between 26 weeks until birth. So what is happening in the terminal sac stage? In this stage actually there is establishment of blood-air barrier. So what do you mean by blood-air barrier? So at this moment the epithelium will get thinned out and there is perfect gas exchange between the endothelial cells and the epithelial cells. So that is what is happening in the terminal sac stage. The terminal sacs are developed and there is perfect exchange of gas between the endothelial cells and the epithelial cells. Now the fourth stage is known as alveolar stage. So when will it happen? So alveolar stage, when we discuss, there is a slight overlap between the terminal sac stage and alveolar stage, because terminal sac stage we have already mentioned it as extending between 26 weeks till birth. But when we see the alveolar stage, it is actually again occurring simultaneously because it starts from 32 weeks till birth and even it extends up to 8 years after birth. So that is the importance of alveolar stage. So what is happening during alveolar stage? We have already mentioned about the exchange of gases, but for proper exchange, for the efficient exchange of gases, 3 things should occur. So 1, 2 and 3. So what is the first thing? The first thing, the alveolar sac should secrete surfactant. So that is the first thing which should occur. The second thing what should happen is the lungs should actually be transformed from the secretory phase to the gas exchange phase. That should happen again for a proper exchange of gas. The third thing which should happen is the establishment of pulmonary and systemic circulation. So for proper exchange of gases, these three components should be there, and this is happening in the alveolar stage. So what are the steps needed for the production of surfactant? The surrounding lung fibroblast secrete a substance known as fibroblast pneumocyte factor, that is known as FPF, fibroblast pneumocyte factor. So the lung fibroblast will stimulate the fibroblast pneumocyte factor, which will in turn stimulate the type 2 pneumocytes in which the surfactants are stored, and that will result in the release of surfactants. This actually happens in the 7th month of intrauterine period. That is the reason why the 7th month is considered as the viable age of fetus. So what will happen if there is a premature labor? In this condition, you might have seen or you might have heard that we give cortisol to the fetus through the mother. So how it is acting? So when we give cortisol, this will actually stimulate the fibroblast pneumocyte factor, which will in turn stimulate type 2 pneumocytes and will release the surfactants. So that is the reason why we are injecting cortisol in premature infants through mother. Now let's see what are the defects in the development of respiratory system. So defects in the respiratory system are seen as one of the components of a group of anomalies known as vacteral. VACTERL. So V stands for vertebral anomalies, A stands for anal atresia, C stands for cardiac defects, T stands for tracheoesophageal fistula, E stands for esophageal atresia, R stands for renal anomalies, and L stands for limb defects. So any anomalies in the respiratory system can be seen as one of the anomalies of a group of anomalies known as vacteral. So V stands for vertebral anomalies, A stands for anal atresia, C for cardiac defects, T for tracheoesophageal fistula, E for esophageal atresia, R for renal anomalies, and L for limb defects. Another important thing we should mention is about the hyaline membrane disease or respiratory distress syndrome. You might have heard a lot about it. So what is happening? When surfactant is absent or deficient, there is a waxy lining inside the alveoli that is known as hyaline membrane, and when this lining is formed, there won't be efficient gaseous exchange. So that is what is happening in hyaline membrane disease or respiratory distress syndrome. Another thing is formation of supernumerary loops. Sometimes on the left side, instead of 2 lobes, you will get 3 lobes, and sometimes on the right side, instead of 3, you will get 4, and again there will be vice versa. On the right side you will get 2 and left side you will get 3. So any number of extra pulmonary lobes, you call it as abnormal lobes. And in this context, I would like to mention 2 separate categories. One is azygos lobe and other one is lobe of azygos vein. You should know the difference between azygos lobe and lobe of azygos vein. Azygos lobe is simply any increased number of lobes in the lung. That is simply known as azygos lobe. But what do you mean by lobe of azygos vein? When we discuss about the right lung, so suppose this is a right lung, on the mediastinal surface you usually mark an arch that is known as the arch of azygos vein. Sometimes what happens is the apical lobe, in the apical portion, a part of the apical portion will be seen medial to the azygos vein. So this is the arch of azygos vein. Instead of lying in the mediastinal surface, it will arch over the apical lobe so that a portion of the apical lobe will be lying medial to the azygos vein. So this lobe, it is not actually an extra lobe but a lobe formed because of the arching of the azygos vein. That is known as lobe of azygos vein. So that is the difference between azygos lobe and lobe of azygos vein. Azygos lobe is nothing but any increase in number of lobes, whereas lobe of azygos vein is actually formed due to a defective arching. Instead of the mediastinal surface, it will go towards the apical portion and a part of the apical lobe will be seen medial to the arch of esophagus vein. So that is known as lobe of esophagus vein. Then one important thing is about tracheoesophageal fistula. This can be even asked as a short note. It's a favorite subject for the topic for the examiners. So tracheoesophageal fistula, there are mainly 5 types of fistula. A, B, C, type A, type B, type C, type D and type H or E. It is also known as E type or H type. So what do you mean by tracheoesophageal fistula? We have already mentioned that there is a development of tracheoesophageal septum which is actually separating the laryngotracheal tube and the dorsal tube. So if it is not formed properly, if there is a defective formation of tracheoesophageal septum, that will result in tracheoesophageal fistula. So let's see what are the combinations you get. So in type A, what happens is there is actually no communication. Though it is considered under tracheoesophageal fistula, there is actually no formation of fistula. Here we can see, so all the green lines represent the trachea and all the red lines represent the esophagus. So type A, we can see that there are 2 blunt ends, there is no fistula. So there is no proper communication between the proximal and distal end of esophagus. So this is a pure case of esophageal atresia without any fistula. That is type A variety. What is type B variety? Type B variety, we can see that the proximal portion is actually communicating with the trachea, whereas the distal portion is ending blindly. So this is a proximal fistula. That is, the proximal portion of esophagus is communicating with trachea, whereas the distal end of esophagus it's actually ending blindly. What is type C? Type C, actually the proximal end of esophagus is ending blindly, whereas the distal end is actually communicating with the trachea. So that is type C, and this is said to be the most common variety. And what about type D? Type D, we can see that the esophagus is communicating with the trachea through 2 separate channels. You can even read it as a K. So these 2 portions are actually communicating with the trachea through 2 separate channels. But in type H or E, we can see that the same thing is happening here also. The esophagus is communicating with trachea, but it happens through a common channel. That is the difference between type D and type E. In type D, they are communicating through 2 separate channels, and in type E or type H, that is why this is known as type H, because it is actually taking the shape of an H, because the esophagus is communicating with trachea through a common channel. So these are the different types of tracheoesophageal fistula, and the most common type is type C, the next common type is type A, and the rest remaining types comes to about 1 to 4%. So type C is actually seen in 85% of the cases. So that's all about respiratory system, but I would like to add one more thing here. As the laryngotracheal tube is formed, because of the proliferation of the epithelium of the larynx, the laryngeal inlet is actually occluded in the initial 8 weeks of intrauterine period, and by the end of 10 weeks this will again get recanalized, and during the process of recanalization we get the formation of vocal folds and vestibular folds. So you can add that one more point, that is the laryngeal inlet by the end of 8 weeks will be completely occluded by the proliferation of laryngeal epithelium, and up to the entire length of the larynx the epithelium will be actually occluding the entire lumen, and by the end of 10th week of development it will again get recanalized, and that will result in the formation of 2 folds. They are known as the vestibular fold and vocal fold. So just to summarize, the development starts by the end of 4th week in the form of laryngotracheal dry verticulum. Then you have the formation of tracheoesophageal septum, which separates the 2 tubes. The ventral portion you have the trachea, dorsal portion you have the formation of esophagus. Then the laryngotracheal tube will give rise to the larynx, trachea, bronchus and the lung. Up to the formation of bronchial buds, it is almost happening up to the 5th week of intrauterine period. After that, further development we call it as the stages of maturation of lung. It happens under 4 main headings: pseudoglandular stage, canalicular stage, terminal sac stage and the alveolar stage. And it is in the alveolar stage the main functioning surfactant is produced. by the type 2 pneumocytes, and hence the 7th month is considered as the viable period of fetus. And about the anomalies of respiratory tract development, one is bacterial, then the next one is hyaline membrane disease. Then we discussed about the abnormal lobes under two main headings, the azygos lobe and the lobe of azygos vein, what are the differences between the two, and about the tracheoesophageal fistula, the 5 main types of tracheoesophageal fistula, and the most common being the type C tracheoesophageal fistula. So that's all about the development of respiratory system in a nutshell. Thanks for watching.